Hello guys, my name is Eric Sierra and today we're going to be talking about why children are getting measles. And the year right now is 2015 and there seems to be multiple measles infection prevalent, especially in children. So what is measles? Measles is an airborne infection which is caused by the measles virus. And usually after a week of the infection, you start noticing symptoms. And these symptoms can occur in all ages, children and adults, male or females. And the symptoms usually are you get a fever, you cough, you have a runny nose, you have pink eye or conjunctivitis, or you have a child who has a fever, and a woman who is sneezing. Also, measles, after 2 or 3 days, you will notice these white spots called Koppler spots along the inside of your mouth. You can see them here. These white spots that indicate that you most likely have a measles infection, and this happens 2 to 3 days after you are infected. And after 3 to 5 days, you will notice a rash on your face that will move down to your body. You can see it's like spots. There's spots, red spots, red or pink spots, and you'll get them all around your body. It's more like a rash, large spots, and they spread throughout your whole body. And there are complications in 30% of the cases, usually in children under 5 and in adults over 20. But children are more susceptible to getting measles because adults don't get measles that often because they will probably have been in contact with the measles early in life or are vaccinated. So these complications might include diarrhea, blindness, inflammation of the brain or encephalitis, and pneumonia. And these complications could actually lead to death. The mortality is 0.2%, which means that out of 1,000 people that get measles, 2 of those people might die. That's why it's important to be vaccinated against the measles. You get this MMR vaccination when you're one. You should get this MMR vaccination, which is a live vaccine, and you should get it again, and you get a second dose of the vaccination when you're 4. However, in 1998, a bogus study came out saying that vaccinations against measles or the MMR vaccine will lead to autism. And this study was completely bogus because no other study has shown similar results. This person was probably doing because he was getting paid for it, because during that same time, whoever was funding him, they were also it was a law firm that was also suing the same vaccine company. So I guess they made this bogus study to discredit this company so that they would win the lawsuit. And this agency was actually funding this guy, and because of this result, people started believing that autism was being produced by the vaccination, and this is completely false because, like I said, no other study has shown this ever. This has been the only study, and because of this study that has not been able to be replicated and has no credibility whatsoever, people think that it is okay not to be vaccinated against measles. And as a result, this is what we're seeing today in 2015. Parents disagree with the vaccine and are not vaccinating their children, and as a result, the children are being infected by the measles. There have been over 100 cases now in 2015 because parents decide not to get the measles vaccine. The vaccination is completely safe. I went to high school and I did not notice anyone I went to high school with many people, and everybody in my high school were vaccinated against the MMR. I've seen many patients being vaccinated against the MMR, and never have I seen the MMR vaccination give autism or develop autism in any children or adult. So these studies were completely bogus, and people should stop believing that this leads to autism, which it doesn't. So what are they going to do? They're gonna leave their children unvaccinated, and they're going to risk basically their life. So thank you for listening to my presentation. Please consider having a MMR vaccine to be vaccinated against measles if you have not done so already, which you probably have because you had it in high school. And if you have any questions, please feel free to ask below. Thank you.